Hey guys, so this is a really weird angle, and I'm sorry, but I can't sit up and you'll understand um, once I get through this update. So, if you follow me on Instagram, you already know, but last week I was in the hospital and I made a post about being medically gaslit um, by doctors when you know your own body. You go in for help and like they act like you don't know what you're talking about, or things aren't as serious as you feel they are. So this is going to be a TMI video, like very much TMI. So just saying that up front. So ever since I had colon cancer, cancerous polyps removed from my colon, I will get hemorrhoids from time to time. And they've never been like bad to where it's been this kind of situation. I mean, they're literally a pain in your ass, but like they've never been like this experience is completely different. So I've been dealing with hemorrhoids they've never lasted this long. So like 3 months. Um, like they just wouldn't go away, but they were manageable, if that makes sense. Like with ibuprofen if I needed it, like at home stuff. But like the last, you know, week before I was in the hospital, they became like what I felt was not manageable anymore. And I was trying to get in to see my GI doctor. It's very hard to get in to see him. He's the one that does my yearly colonoscopies. Because it's like this time it wasn't going away, and I had never experienced that. Like usually in a few days they like calm down and whatever. And I couldn't figure out like what was causing it. I kind of think that maybe it's all the hormones that I've been on. Maybe kind of kick that up. So it's like I don't even know. But anyways, I went to the ER because I was like, something's not right. I was losing so much blood every time I went to the bathroom, like so much blood. Which is also something I have not experienced, like blood loss like that. And if anyone knows me, they know my pain tolerance is insanely high. I was in a crazy amount of pain. Like, I don't think Justin or my dad have ever seen me in the kind of pain. Sorry. The kind of pain I was experiencing. It was just, I knew something was wrong. I said, I think I have some kind of infection, because it was like, I went to the ER and then, they put me in a room. They gave me like a shot and it didn't do anything. Well, okay, so I was like, and they gave me like numbing gel, and I was like, my hemorrhoids are numb. They're not bothering me. I'm like, this is something else. I was like, this pain that's coming from that area, I'm like, it's not the hemorrhoids. I kept saying, I feel like I have an infection. The first doctor that saw me, like, it was like shift change or whatever, and he didn't take it seriously at all. The second doctor was listening to me more, in a sense that it was like he genuinely, I think the first doctor thought I was just seeking pain meds or something, which is crazy because I was like, I need you to make sure I don't have an infection. It was like not like I have all kinds of narcotics because I live with a chronic illness. You know what I mean? Like, and I told him that I'm like, I don't need to come to the ER to get like pain meds. You know what I mean? I was like, I'm here because something feels wrong. The second doctor, he ordered a CAT scan, and he's like, I'm going to start you on an IV. We're going to keep you here a while. So he's like, but first we're going to send you to CT. So they started a line. Then this is a female nurse that did my first line, and she was great. She got it in. The line was fine. They they had to help me go to the bathroom because at this point, sitting and standing up, like moving, was excruciating. I have no dignity left after this. Then they had to help me onto the CAT scan bed thing. And so the guy is like, okay, just, if you've ever had a CAT scan, it's like, hold your breath, breathe, hold your breath, breathe. And then they're going to shoot the contrast. The machine itself shoots the contrast. If you've never had a CAT scan with contrast, they hook the machine up to your IV and it shoots the contrast through you. I've had CAT scans before. I had one after having COVID of my lungs, and it's like it sends the contrast through. Your body feels warm and almost feels like you're going to pee yourself. And then, it's if you've had it before, you know what it feels like. So I wasn't anxious or anything. I had a CAT scan before. So he puts me in, and like it does the first test runs, and then it's like spinning up really fast to do the injection. And I feel the contrast coming, but it doesn't feel like it normally does. My arm is burning. It is hurting. There is a pressure. And I was literally like, something's wrong. I was like loud. I'm not gonna be loud now because I don't want like people in my household to think I'm saying like something's wrong up here. Something's wrong. I was like, hello, hey, something's wrong. Something's wrong with the contrast. Like I kept saying that and he couldn't hear me. I don't know if the machine's just loud, and they also close that door, because they don't want to get radiation or whatever. And I look over, I'm freaking out. My arm is blowing up like there's a ball in, and it was right there. And I'm freaking out, right? Like totally freaking out, which probably did not help like the situation because I'm having like a panic attack because I don't like needles. I don't like IVs. I have a huge problem with it. I don't know if it's just, a lot of people don't, but like sensory wise, it's a nightmare for me. And so the guy finally comes out, he opens the door, and then he gasps and he sees my arm. He's like, oh my God. And he's like, there's a pressure system. He's like, I monitor the pressure system in there. The machine is supposed to shut off if the pressures change because this can happen. Like, he's like, basically your vein exploded and it was pushing contrast into my tissue, like the tissues in my arm. And he's like, the machine failed to like send that pressure alert and shut off, which is just my luck, right? And I'm just like, at this point, I am like hyperventilating. I'm like, okay, what do we do? What do we do? And he's like, he put a syringe and tried to like pull contrast out and was not coming out. And I'm just like, can you take it out? Can you take this thing out? I'm like, I'm freaking out. I'm trying to be calm. He takes it out and he starts putting warm compresses on. And then, he's like, I'm going to try to start a line on this other arm. And I'm like, dude, oh my God. So by the way, there's pictures of what they did to my arm on Instagram, and I'll probably make it like I'm doing all this on my phone. So I'll try to put it in the thumbnail. But it's hard to see now because it's been 2 weeks. But he blew out that vein. There's also this, and this is much better. This was like most of my forearm looked like that. So it's been 2 weeks. So things are healing. So he blew this arm out. And he's like, I've got to take you back to your room. They take me back to my hospital room. A different nurse comes in, and this nurse is like, I'm going to start a line. He's like, they just blew out your only good vein on this arm because this is my infusion arm. This was my good vein arm, but all of the scar tissue from all of my infusions have made it impossible to get anything out of this arm, which is why they did this arm initially, but my vein exploded in this like part of my arm. And, so he went in here, like that part of my arm was swollen. And my friend that's an EMT is like, the fact that they would even try to run a line on an arm, because at this point, this arm is very swollen from the contrast tissue damage. The dude puts 2 needles. I don't think you can still see it, but there's 2 needle marks there. He had 2 needles in my arm at the same time, trying to dig around and find a vein. And then he just kind of picked one and pulled the other one out and then put like the catheter thing in. And he's like, I'm going to flush it. He flushes it. I said, you're not in my vein. Like, you're not in my vein. I was like, I always taste the flush. I didn't taste it. You're not in my vein, and it hurts. Like, because it doesn't hurt when it's in your vein once it's in and everything's right. I'm like, you're not in my vein. And he argued with me. He's like, yes, I am. It's fine. I'm in your vein. You're just worked up from what happened. And y'all, I'm just, so he puts my IV bag on and leaves the room. He's like, I'm going to get morphine because my heart rate's high. Like, they can tell I'm in pain. Whatever they gave me first didn't work. And they're like, we're going to get you a morphine drip. And I'm just like, okay. But I'm like, again, I'm like, if it's an infection, that's why the other stuff didn't work. I was like, I kept telling the doctor, I know I have an infection. I've had a staph infection post-surgery before, and it's the same situation. Like, no matter what they gave me, and at that time too, my surgeon told me, like, no, it's not an infection. It's just like a rub mark from surgery. And I was like, no, I'm pretty sure it's an infection. It really hurts. And then 2 days later, it opened up. I had a softball size infection under my skin. You know your body. And I kept telling the doctor that. And he's like, well, the CAT scan will tell us. So he's like, so we're going to get you the pain meds. Then we're going to try again with the contrast through this new line. Right. So the nurse leaves and I'm like, my arm starts blowing up more because he's literally put a drip bag of like solution, like an IV of fluids running into my tissue again, because it's just going under my skin. It's not actually in a vein. And at this point I am like, I can't even. The whole arm looked like an elephant arm. My arm hurt for 3 days. I literally feel like I was just battered and abused in the hospital. So this is, again, TMI. They can't get the nurse is like, well, shit. I'm like, I told you you weren't in a vein and you didn't listen to me. And then you hung a bag anyway. I have no patience left. And the doctor's like, we can't get a vein. We're going to we're going to get with radiology and see if we can do I laugh now, but at the time I was just like delirious, swollen. Like I was like a rag. They're like, we're going to try to do a rectal contrast. We're going to try to give you a contrast enema to get this CT scan. And I'm like, okay, so the guy goes and leaves and the doctor leaves and they get with radiology and there's a whole team of people this time in the room. I have no dignity left because the amount of people have been up my asshole at this point. Like, I'm sorry for the language, but it's just like I'm coping with humor because, you guys, this was such a traumatic experience for me. I'm not even, like, we're not even at the worst part. So anyways, they put this contrast thing in me to several people. They like, because my bottom was so irritated, like swollen. It took a team of people to get this enema in me, and like it was awful, but they got it done, right? And then the person that actually put the enema in was the girl that got the line the first time. I really liked that nurse. She was great. She was really pissed at the male nurse that went and put the other line in me. Like, she was awesome. She was the one person that I felt like really was listening to me. And she told me, she said to me, she's like, I think you're right about your infection. When I was doing your enema, there was like pus and blood coming out. And I was like, okay, because like at this point, that if there had been pus in the toilet when I went to the bathroom, I would not have known because there was so much blood when I would go to the bathroom. So I'm just like, oh my, thank God. Like, so I'm not crazy. Like, it just made me, the CT scan came back and the hospital doctor is like, you don't have an infection. It didn't show. And the nurse, like, he's just like dismissive. He's like, if you had an infection, it would be on the CT scan. So what they did is they gave me more pain medicine. They like ordered all this stuff, whatever. Anyways, I come home the next day, and my specialist finally was like, "Oh, we can get you in like on a Thursday." I was it was Wednesday, the day before. I was in the hospital Tuesday. I'm trying to remember this because it's 2 weeks ago. And okay, so on Wednesday, I'm laying on my side like I am now because I literally I can't sit on my bottom. I can't stand. Like, that's how bad the pain was. And my underwear feels wet. And I'm like, what is that? And just pus and blood. It's disgusting. I'm sorry, TMI, but, and I was like, I fucking knew it. Like, I knew I had that. I knew it. So the next morning, it was early morning, my appointment, I went to my GI doctor. He verified, he's like, you have a colon, and all the things they did to me, not one of them did a actual rectal exam to where they like open your rectum, which I get it. I was hollering about pain down there, but I had the same situation at my doctor, and he's like, I have to do this. I'm like, do whatever you need to make this stop, because I have such a high pain tolerance. And that's the other thing I told him in the hospital. I'm like, if I'm feeling pain like this, I know it's an infection, because I just know. But so he did the proper rectal exam, everything. He said the CT scan does not find this kind of infection. He's like, it should, if they were going to do imaging, it should have been an MRI. The MRI would have found this, but not a CT scan, even with contrast. And so, I'm sorry, this is a long video, guys, but I'm trying to get through all this. So anyways, when they discharged me from the hospital, they said that I had nerve damage from the hemorrhoids. Because like a lot of the things I was describing, like I told him too, like, I'm like, there's weird stuff. Like if I go pee in the bathroom and then I wipe myself afterwards, if there's a pressure on that area in the front, I can feel a stabbing pain in the back. And from that, they were able to tell that I was having severe nerve pain. And so they were like, oh, your nerves are damaged. That's what they ended up discharging me with, like nerve damage from hemorrhoids. And so my doctor found that my colon was severely infected, and there is an abscess like towards the back of my colon, kind of like, I guess, near your spine or your tailbone. And it is pressing on a cluster of nerves there that kind of control your bowel movements, your urine output. Like, I also couldn't pee. When I went into the emergency room, I could not urinate anymore. Even though I felt I had to, I physically could not, and it was scaring me. And that was because that abscess that had been created in my colon was pushing on that cluster of nerves. And he was like, I would usually do surgery on this and clean it all out and clean the abscess out. He's like, but I don't want to do that. I can't do that with how it is with your nerves right now. So I've been on a really aggressive antibiotic treatment. And finally, after a few days of the antibiotics, and he said I was like a few days away from sepsis, like a couple days away from sepsis at that point when I saw him. So everything I thought when I went into the ER was right. I did have an infection. I just got tortured and released. And I'm like, mentally, the past 2 weeks are just like a blur, because mentally it's one of the hardest things I've ever gone through, because I can push through pain. And this is the first time in my life I have been down for 2 weeks. Like, even now that the infection, I've had so much drainage. The antibiotics have definitely been working. I've been feeling better. Like, my pain is so much better. It's not completely gone. Like, I'm not completely like what my normal pain levels are with fibro, or like just a consistent, this is how I feel daily. I'm not there yet. today I went with a friend for an hour. It's the first time I've driven in 2 weeks or left my house besides going to the doctor in 2 weeks. I did go to my dad's and I laid down the whole time. It was his birthday this past weekend because I couldn't do anything else. But it was the first time like I drove, and I was only out for like an hour. We went to an event in a library with our kids, and that was like, it wiped me out. Like, it's crazy. Like, I can't sit again. Like, because I was sitting straight up the whole time when I was driving too. And so it's just been crazy. I've lost, I think, 13 or 14 pounds now in this amount of time. Which, I mean, I'm not mad at that. Like, but it just, I literally feel so, I don't want to say traumatized, but a little bit from the fact that I went to a hospital for help and I was just gaslit and released with something that could have killed me. And so that just like mentally messed with me. And then the amount of pain I've been in, like I have a very high pain tolerance, guys. And even when I'm in pain, I will push through. And this is really, truly the first time in my life I have not been able to do that. And this is the longest recovery I've ever had on anything. And that also freaked me out. Like, it's just, it's been like, aside from the physical stuff I've been going through, like I've been going through a lot of mental stuff. So this is like highly TMI and, you know, probably gross for a lot of people to hear. I feel gross talking about it, but at the same time, I want people to like know that if you truly like, don't accept something if you feel like you're not being heard, you're like not being listened to. Looking back, there are things I do. I've been gaslit before because of my heart and emergency medical situations, and my cardiologist has taught me to go into an emergency situation, because a lot of times with women, if we think we feel something in our heart, they'll automatically assume we have anxiety. They will give us anxiety medicines before they even start listening to our heart, putting us on a monitor. Whereas a man will be treated differently. And my doctor is a male cardiologist, and he said this, and I've experienced that. And the one thing he told me to do in those situations when I go into is, I'm a heart patient. This is what I'm experiencing. And if they don't take me seriously, now I know, after what I've been through too, to be is like, I don't want anxiety medicine. I know this is in my heart. I want it noted in my chart that I did not want anxiety medication. And then I came in here telling you I was a heart patient. And once he taught me that, like, it was a game changer, because once you're like, I want it noted in my chart, they don't want to get sued. But in this experience, I think I probably could have used that and be like, I want it noted in my chart. I said I had an infection, whatever. And I probably could have got more action from that. Like, I probably could have got the doctor to listen to me more. But I'm not kidding, guys. And now I know it was an infection and extreme nerve pain. But I have nerve pain with fibromyalgia. And so I just never in my life have felt that amount of pain. And so I couldn't even think straight. I was shaking. I was sweaty. It was so bad. And then every time they did something to me, like my vein exploded. And I'm not blaming that part on the hospital, because if the machine malfunction is just like, your vein can explode sometimes like that. If it's just, it's not the hospital's fault. Unless they're not taking care of their equipment, that the monitor didn't pick up the pressure difference, right? I don't fault them for that. I do fault the nurse for trying to put another line in that arm, and for not listening to me when I said it wasn't in my freaking vein, which made the situation worse. But from this experience, I've learned that no matter how much pain I'm in, I need to remember to say, I want it noted in my chart that I told you, I think this, I feel this, I want this, it's not this. Like, whatever you need to say. So that's why I'm sharing my story. This has been like the grossest, most painful thing I've ever gone through. Y'all, like, for real, for the past 2 weeks, I've had to wear adult diapers. Like, it's gross. I don't know when. Sometimes during the day, like, I will get pus and blood just draining, and it is a nightmare. Like, I'm like legit feel a little like I feel I'm laughing saying this because like I deal with stuff like this with humor, but I feel really traumatized from this. And if I can spare somebody from going through what I just went through, then it's worth sharing my disgusting TMI story. Anyways, hopefully in a week or so, I'll be back. I feel like I keep saying that. But that's just what's going on. I'm sorry this video is so long, but like I said, I hope it spares somebody what I went through. I'll see you guys in my next video. Bye.